Arthroscopic assisted distal radius fracture fixation. This is an X-ray and a CT scan of a 45-year-old female with intra-articular distal radius fracture with significant step and gap. There was associated ulnar styloid fracture as well. We employed the trans-FCR approach for this fracture. The FCR sheath was incised and retracted ulnarly, and soft tissue dissection was performed to expose the pronator quadratus, together with the brachioradialis and the first extensor dorsal compartment. Brachioradialis tendon was incised and the pronator quadratus was elevated to expose the fracture site. An obey maneuver was performed by hyperpronation of the proximal fragment to debride the dorsal hematoma and callus over the dorsal metaphysis. Manual reduction is then performed to align the volar cortices, and one may place temporary K-wire fixations to hold the reduction. One may also consider using a bone tenaculum clamp, especially when there is a sagittal split of the fracture fragment. Once the fracture was well reduced clinically, we did a preliminary plate placement with a cortical shaft screw in the oblong hole. We then begin our wrist arthroscopy with 3-4 portal as the viewing portal and 6R portal as a working portal. Synovectomy is performed. The intra-articular fracture pattern, fracture step and gap is better appreciated with 6R portal as our viewing portal. Fracture callus and hematoma is debrided using an arthroscopic shaver through the 3-4 portal. Here, one can appreciate the fracture step and gap, especially at the intermediate as well as the radial column. To facilitate intra-articular fracture reduction, multiple subchondral K-wires may be placed as shown in picture B. In addition to joystick K-wires that is placed subchondrally, one may also use an arthroscopic probe as well as Watson chain to aid in reduction. In most cases, Watson chain is used to depress elevated fragments. One may also employ extrinsic pressure using the thumb and index finger to facilitate reduction. Once the intra-articular fracture reduction is satisfactory, distal row locking screws are placed. These are the post-operative images which shows satisfactory intra-articular reduction as well as distal radius alignment. This slide shows our post-operative rehabilitation regime. Thank you.